Hello and welcome. Today we're shedding light on a significant health concern: colorectal cancer. This video will provide a comprehensive overview of the disease, covering its causes, symptoms, diagnosis, treatment, and prevention. Understanding colorectal cancer is crucial for early detection and improved outcomes. The exact cause of colorectal cancer isn't always clear, but several factors are known to increase the risk. These include age, with most cases occurring after 50. Family history of colorectal cancer or polyps is another significant risk factor. Certain inherited conditions, such as familial adenomatous polyposis, FAP, and Lynch syndrome, dramatically increase the risk. Lifestyle factors also play a role. A diet high in red and processed meats, low in fiber, and physical inactivity are all linked to increased risk. Smoking and excessive alcohol consumption are also contributing factors. Inflammatory bowel diseases, like Crohn's disease and ulcerative colitis, can also elevate the risk of developing colorectal cancer. Colorectal cancer typically develops from abnormal growths called polyps in the colon or rectum. Over time, these polyps can undergo genetic changes that transform them from benign to malignant. The process usually starts with mutations in genes that control cell growth and division. These mutations can lead to uncontrolled cell proliferation and the formation of a tumor. As the tumor grows, it can invade the surrounding tissues and eventually spread to other parts of the body through the bloodstream or lymphatic system, a process known as metastasis. The location and extent of the cancer determine the stage of the disease and influence treatment options. Colorectal cancer is a global health problem, with hundreds of thousands of new cases diagnosed each year. It's one of the most common cancers in both men and women. Incidence rates vary depending on geographic location and ethnicity. In general, developed countries tend to have higher rates of colorectal cancer. However, rates are rising in some developing countries as they adopt westernized diets and lifestyles. Regular screening is crucial for early detection and prevention, especially for individuals over the age of 45 and those with a family history of the disease. The signs and symptoms of colorectal cancer can vary depending on the size and location of the tumor. Some people may experience no symptoms at all, especially in the early stages. However, common symptoms include changes in bowel habits, such as diarrhea or constipation, that last for more than a few days. Blood in the stool, which may appear as bright red or dark black, is another concerning symptom. Persistent abdominal discomfort, such as cramps, gas, or pain, should also be investigated. Unexplained weight loss, fatigue, and the feeling that your bowel doesn't empty completely are also potential indicators. It's important to consult a doctor if you experience any of these symptoms. Diagnosing colorectal cancer typically involves a combination of physical exams, imaging tests, and biopsies. A colonoscopy is the most common and effective diagnostic tool. It involves inserting a long, flexible tube with a camera into the rectum and colon to visualize the lining and identify any abnormal growths. During the colonoscopy, polyps can be removed and biopsies taken for further examination. Other diagnostic tests may include stool tests, such as the fecal occult blood test of FOT or fecal immunochemical test of FITI, which can detect hidden blood in the stool. Imaging tests, such as CT scans or MRI scans, may be used to assess the extent of the cancer and determine if it has spread to other parts of the body. A digital rectal exam is also useful in some cases. Colorectal cancer can be classified based on several factors, including the location of the tumor, the stage of the cancer, and the type of cells involved. Adenocarcinomas are the most common type of colorectal cancer, accounting for the vast majority of cases. These cancers develop from the cells that line the colon and rectum. Other, less common types of colorectal cancer include squamous cell carcinomas, carcinoid tumors, and lymphomas. The stage of the cancer is determined by the extent of the tumor and whether it has spread to nearby lymph nodes or distant organs. Staging is typically based on the TM system, which considers the size of the tumor HT, the involvement of lymph nodes NEN, and the presence of metastasis MNR. Treatment for colorectal cancer depends on several factors, including the stage of the cancer, the patient's overall health, and their preferences. Surgery is the primary treatment for most cases, involving the removal of the tumor and any affected lymph nodes. Chemotherapy may be used before or after surgery to kill any remaining cancer cells or shrink the tumor. Radiation therapy may also be used, especially for rectal cancer, to shrink the tumor or kill cancer cells. Targeted therapy and immunotherapy are newer treatment options that target specific molecules or boost the body's immune system to fight cancer. Regular follow-up appointments and screenings are essential after treatment to monitor for recurrence. There are several steps you can take to reduce your risk of colorectal cancer. Regular screening is the most important preventive measure. Colonoscopies are recommended starting at age 45, but earlier screening may be recommended for individuals with a family history of the disease. Maintaining a healthy lifestyle is also crucial. This includes eating a diet rich in fruits, vegetables, and whole grains, and limiting red and processed meats. Regular physical activity, maintaining a healthy weight, quitting smoking, and limiting alcohol consumption can also help lower your risk. Consider discussing aspirin therapy with your doctor, as some studies suggest it may reduce the risk of colorectal cancer. The prognosis for colorectal cancer depends on several factors, including the stage of the cancer at diagnosis and the effectiveness of treatment. Early detection and treatment significantly improve the chances of survival. Advances in treatment, such as targeted therapy and immunotherapy, are improving outcomes for many patients. Researchers are also investigating new ways to detect colorectal cancer earlier, such as through blood tests and advanced imaging techniques. Ongoing research is focused on understanding the genetic and environmental factors that contribute to the development of colorectal cancer, which could lead to new prevention strategies and treatments in the future. The information provided in this video is for educational purposes only and should not be considered medical advice. Always consult with a healthcare professional for any health concerns.